Well, we did a randomized controlled trial that was double-blind, placebo-controlled, that investigated the role of a post-allo stem cell transplantation maintenance therapy with an FLT3-ITD inhibitor called Sorafenib. Sorafenib is an approved drug that is primarily used for the treatment of solid cancers like renal cell cancer or hepatocellular cancer, but it has also activity in inhibition of FLT3-ITD. So the question of our trial was whether we can prevent relapses after stem cell transplantations in patients that received their transplantation for their FLT3-ITD-positive AML. And this is the first study that has done that in a randomized and controlled, double-blinded fashion. And we recruited 83 patients that were one-to-one randomized, and the result of the trial is that it is positive for the primary endpoint, which was relapse-free survival. And there's a significant benefit of over 30% at 2 years for the patients that received the Sorafenib compared to placebo. And this also translated in a superior overall survival after the end of treatment and end of study at 30 months. So patients have a survival benefit. And that is the key message from this important trial. And we think it is practice changing because it is just life-saving. So it has implications for future design of future trials with novel drugs, novel FLT3 inhibitors that are now coming into that disease, like gilteritinib and quizartinib. There's a study ongoing with gilteritinib randomizing in an identical fashion like Sorafenib. And we will see whether the effects that we have seen are Sorafenib specific or whether this is a class effect. And this will be seen in the future, but only in many years from now because the study just started recruitment.